It's quite old. Well, what were we saying on this?
That's 1964, so this is...
that must be 1968.
Wow. 73-year-old Derry Roberts spent more than half a century working as a nurse. After retiring 3 years ago, she could be one of thousands called back into duty as the UK prepares to battle the coronavirus.
And obviously, I'm not now registered because you give it up when you retire. There's got to be some quick and safe process to get us all re-registered now, not in months' times when it's too late, so that if we're wanted, when we're wanted, we're ready to go.
And you've been out of the game for a few years. Are you ready to go back to work?
Depending on how, what they want us to do and how they want to play, obviously could consider that. But I think I could, yes, I could pick it up quite easily.
If there's a major outbreak in this country, that could put an even bigger strain on hospitals like this one up and down the country. And it's not just former staff worried about the impact that could have on their lives, but those already working in the health service too.
The GMB trade union represents more than 620,000 workers across the UK, including some of the lowest paid in the health industry, such as cleaners and caterers. If they contract the coronavirus, the official advice is to self-isolate, but that could see their wages cut by more than 70%.
Our members are earning the minimum wage, so if you work 37.5 hours a week, you're looking at about £300 a week to take home. That is not enough to live on anyway, so then if you're asking them to reduce that down to statutory sick pay, they're going to really struggle to pay the rent. I mean, it's completely outrageous that this is not being addressed by the government.
On Tuesday, Prime Minister Boris Johnson unveiled a 28-page battle plan to tackle the disease. In the worst-case scenario, the government says schools could be closed, police services reduced, and up to 20% of people may need to work from home. But with almost 14,000 now tested for the virus and only 51 confirmed cases, there was also a call for calm.
There are certain things we know now, and I think we are reasonably confident that overall, probably around 1% of people who get this virus might end up dying based on the Chinese experience. Now, to be clear, what that therefore means is 99% of people will not.
As COVID-19 spreads rapidly outside China, countries are rushing to formulate their response. But for those who may be directly impacted by the UK's plans, there are still plenty of unanswered questions.